Day surgery, hip and knee replacements, and overview.
In this video, I am going to give an overview of day surgery hip and knee arthroplasty and how we are implementing this at Aesthetic Unit. Thanks for watching.
In the later half of this presentation, we've also included a number of patient journey videos. Historically, patients used to stay in the hospital for weeks after hip and knee replacements, particularly after hip replacements, when they used to be kept in the bed for a few days. Even a few years ago, it was not uncommon for patients to stay in the hospital for a week or so. There was lack of preoperative counseling, physiotherapy was delayed, there was no standardized pain control protocol. Patients, in fact, expected to stay long in the hospital. We started the Rapid Recovery Program at Aesthetic Unit in 2012. We noticed that the average length of stay decreased. Some patients were going home in 1 or 2 days. In fact, few went home on the same day after knee replacement as they were doing very well. However, Day 0 discharge was felt to be a step too far at the time, and hence we did not formalize it at that time. If you look at the recent global picture, there's increasing trend towards outpatient hip and knee replacements. This is particularly prevalent in US. It's been projected that about half of all hip and knee replacements are going to be done as a day surgery procedure by 2026. That's a huge transformation. Just over a year ago, I visited the New Albany Hospital, where they do a large number of hip and knee replacements as a day case procedure. It was quite impressive to see how they worked as a team to make it as a success. One of the things I found which is quite interesting was that how the patients and the carers were involved actively in the whole process. It is also becoming common in some European countries like Netherlands. Select few hospitals in UK have also started doing day case arthroplasties. If you look at the literature evidence, it appears that with proper selection of patients and processes in place, there is probably no significant difference in the complication rates. A recent review paper suggested that day surgery hip and knee replacements are as safe as conventional inpatient procedures and might be beneficial for patients and healthcare systems. It is important to understand that same-day discharge does not mean that we are cutting corners. If you look at the Formula One pit stops, you can see the huge difference between the 1950s and the current pit stops.
But Holland comes in for a pit stop. Time to refuel and change tires. Lou Moore himself changes the tires. Only... The tires are changed at last. A crewman polishes the windshield as Holland moves away just 67 seconds after he stopped.
What a huge difference. Obviously, they are not cutting corners, but they are doing everything better, faster, and in a more coordinated way. This is what we are aiming to do with day surgery hip and knee replacements. Obviously, doing hip and knee replacement are not as simple as pit stops. Hip and knee replacements are still major surgery. Every patient is different. The cars do not complain of pain, swelling, or sickness. The success of day surgery hip and knee replacement depends on a number of factors: minimally invasive surgery, standardized pain management pathways, better anesthetic techniques, immediate physiotherapy, and optimizing recovery are some of them. A very important factor is the pre-operative education and preparation of the patients and their carers in understanding how to manage after going home within few hours after major surgery. Patient selection is also very important. A well-motivated patient will be most suitable. The patient should also be reasonably mobile before surgery. If the patient has multiple pre-existing medical problems, he or she will not be suitable for day surgery. It is very important that they have a carer who can look after them in the immediate post-operative period after going home. Towards the end of last year, we had discussion with our multidisciplinary team, including the anesthetist, pharmacist, occupational therapist, preoperative nurses, and ward staff to form a day surgery orthoplasty pathway. We arranged for multidisciplinary team to be involved in careful preoperative education and preparation of the patient for surgery. We involved the carers in the process. We standardized the pain management protocols and take-home medications. We made arrangements to have post-operative blood tests and X-rays to be done within few hours after surgery. We arranged for the physiotherapist visit next day and patients to be seen in a week in the clinic after surgery rather than the usual 6 weeks follow-up. We successfully started doing day surgery orthoplasty in February 2020. Unfortunately, with COVID-19 lockdown, a break was put into everything. Now we are gradually starting some elective procedures again. The COVID-19 situation has also given a different perspective in day surgery orthoplasties. It's likely that the risk of COVID-19 will be reduced with shorter stay in the hospital. Hence, we have recommenced day surgery hip and knee replacements in suitable patients. The following are small video clips of patients who had their hip and knee replacement surgery as day case procedures as aesthetic unit to show what to expect after surgery. We are also putting full-length patient journey videos from admission to discharge as separate videos, which you may find interesting. This gentleman had a total knee replacement and it's about 5 minutes after coming to the recovery.
Hello sir, how are you feeling now?
I'm feeling fine.
So it's about 5 minutes or so since you came to the recovery.
Yeah.
How are you feeling? You okay? You're not feeling
fine.
any faintness or anything
Nothing
like that?
at all, no.
Okay.
Feel
So
normal.
you can have that when you go to the ward.
Yeah.
You can have something to eat and we'll get you up soon. Alright sir?
Thank you.
Okay, good.
Thank you.
Thank you.
As you can see, he looks well and is quite cheerful. This gentleman is just a couple of hours after his total knee replacement.
90 degrees already.
Yeah.
Straight on the leg, please.
Yeah.
Bend the knee, sir. Okay, sir.
Yeah,
So they're going to
sir.
give you lunch. We'll get X-rays and get you up.
Okay.
All right.
The same patient within 5 hours after total knee replacement.
Encourages other people.
He is mobilizing with crutches already. As he has practiced the crutches before coming to the hospital, it has helped him to mobilize confidently with the crutches soon after surgery. This lady had a total hip replacement 5 hours ago. Again, she is able to mobilize with crutches. After knee replacements, we also use cryocuffs. They have inner sleeves to place ice packs. Although bulky bandages are usually used in the immediate post-operative period, I've started using cryocuffs soon after surgery. The ice packs reduce pain and swelling. In addition, they can also be removed easily to mobilize the knees, as you saw in the previous videos. You can also take this home and use it over the first few days. It's important to understand that the pain and swelling will be worse during the second and the third post-operative day. Our discharge criteria is same as our inpatient orthoplasty criteria. There should not be any excessive bleeding. The pain should be under control. Physiotherapist and occupational therapist should be happy that you are safe to go home. Post-operative X-rays and blood should be satisfactory. We give advice on dressing and bandages. We give written advice on take-home medications including painkillers. We also give the contact details if there is any concern after going home. This is how the written information is provided. Essentially, we are giving almost everything that you're likely to be given, even if you had stayed in the hospital. This is in quite a bit of detail. It's important to understand and expect that the pain may be worse in the second and third post-operative days, hence we are giving all the different painkillers. In fact, we are giving a bit more supply than you're likely to need as a precaution. We would like you to bring the remaining pain medication, particularly the long tech and short tech, when you come to the hospital so we can dispose it safely. There is also a separate video by our pharmacist who explains in detail about all the medications you're likely to be given to take home. Please watch it along with your carer. Finally, discharge. This patient is going home about 7 hours after his total knee replacement. Let us hear what he says.
Happy to go home?
Yes.
So you've done everything? The
Yes.
physio's seen you?
Yeah, everybody's seen me. And
Good. Happy with the painkillers?
Yes. Yeah.
Good. So we'll give you a ring tomorrow.
Okay.
This lady is also about to go home. She's had her total hip replacement about 7 hours ago.
Okay,
How's the pain?
it's bad, but
You're manageable.
I'm managing. They just gave me another one of those painkillers. Yeah.
So you've done the stairs as well, isn't it?
I've done the stairs.
Stairs.
Yeah, been up and down there.
Ready to go?
Yeah.
So you got all the details of the painkillers, everything we'll give?
Yeah, I've got them at home, but
Yeah.
I think you were going to find them.
Yeah, I'll give you a
Yeah.
copy of that.
So I know what's happened today.
I'll speak to you tomorrow and make sure everything is okay.
Okay.
All right.
Yeah, that's
Well
brilliant.
done.
Yeah,
Excellent.
thank you very much.
Thank you.
As you can see, she still has some discomfort, but she's confident that she'll be able to manage the pain as she has been given all the information pre-operatively how to manage pain after going home. You can watch the full journey of both these patients from admission to discharge in a separate video. This lady was the first patient to have day surgery total hip replacement at aesthetic unit in February 2020. This obviously was before COVID. The occupation therapist and the physiotherapist visited her at home on the first post-operative day. We'll see what she's doing. She was already making her own cup of tea. As she was our first patient, I also was not sure how she would be coping. I asked her to do a video blog to capture how she was coping during the first week. There's a separate video where you can watch her going through her video blog. It was quite fascinating for me to watch how well she was coping at home. With the COVID restrictions, we had to adapt. The physios were unable to visit patients at their home. Hence, we started ringing the patients. More recently, we are using video consultation facilities, which gives a better interaction with the patients. This gentleman went home within about 5 hours after his total hip replacement. This video consultation with our
consideration,
team
I
is
had all the
happening the
hospital
next day.
painkillers, didn't I, yesterday?
Yes, and
But they won't. So I've taken 3 of the short tech.
okay,
so-
and has that broken through that pain?
Eh?
Has that broken through the pain?
Yeah, well, it does. Yeah.
Okay, and
It's important you take painkillers when it starts because you don't want to leave it too long. Okay.
No.
Usually the second and the third day is when you get more pain.
Oh, there's more to come.
That
No.
is unfortunately the case. Okay.
Oh, yeah. It's all right.
so normally what we tend to see is that the pain you have before surgery is a certain type of pain, so it tends to be
Okay, yeah.
it's there all the time. It doesn't really go away. The
Yeah.
pain you'll feel now is a post-surgery pain,
Yeah.
and that'll get better every
Yeah,
day.
yeah. Yeah.
And that's what we tend to see. Have you been walking around comfortably?
Oh, yeah. Up and
Can we-
downstairs and everything.
Can we have a look?
Yeah. Okay, let's go. He's going off.
doesn't matter, they can see you.
Can you see me?
Fantastic. Yeah.
But yesterday I was running around like a spring lamb because of all the drugs.
And a lot of it's confidence, you see, because in the end, we've taken what you were born with and put something else there instead. So it takes a bit of time for your brain to be happy with it. But you look great.
Yeah, happy with that.
Oh, I'm very happy. I'm very happy.
We'll see you in the outpatient clinic at about a week. The wound will be checked. Your progress will be assessed by the surgical team and the physiotherapist to give you further advice on mobilization and weaning of crutches. This is another patient who is just a week following day surgery total knee replacement.
Right on the leg, please. Bend it, please. Again, once more. Bend it, please. Excellent, sir.
Already, he has excellent range of movement. In fact, he was already able to walk without any crutches. Usually, after total knee replacements, the patients would be requiring crutches for 4 to 6 weeks. He was assessed by our physiotherapist when he came to the clinic, and as he was doing so well, we were able to allow him to walk independently just after a week following his total knee replacement. With preoperative education and excellent pain management, you find some patients are doing extremely well. This gentleman is only 4 hours after his total hip replacement.
Take your time.
That's not in my vocabulary.
Are you feeling okay, sir?
Fantastic.
Good. Okay. Yeah. Shall we try without?
If you like, yeah.
Yeah.
Sorry.
No, you're okay. You're all right.
He is already walking unaided.
Got good control. You feeling okay?
We asked him to carry on using the crutches, and after 1 week when he was seen by the physiotherapist, he was advised to walk with one crutch and then to wean off it as soon as he feels confident. It's important to understand that not all patients will be able to go home on the same day, even if he had planned the surgery as a day case procedure. Some may have to stay in for a day or two due to various reasons, including pain. Occasionally, a patient may need to be readmitted if there are any problems which cannot be managed at home. However, with careful patient selection, preoperative education and planning, the risk of admission should be minimized. Ultimately, the success of day surgery hip and knee replacement is a team effort, and the team includes you and your carer. Day surgery arthroplasty essentially empowers the patients, and we are giving them the choice to go home on the same day if they are suitable candidates. Thank you very much for watching the video.